Hello, and welcome to our webinar today. The topic is Wellness and Mental Health, Part 2. So this is the second part of a two-part series on wellness and mental health. Before we begin our topic, I just wanted to let you know that this webinar was brought to you by the Orientation to Ontario program, otherwise known as O2O. And O2O provides information and valuable support to new refugees who are settling in Ontario. And it does this by offering workshops across Ontario, webinars such as this one that we are delivering today, and other online and print resources. Now, O2O is managed by Costi Immigrant Services, and it is funded by the Government of Ontario. So, let's begin our topic of the day. So as I mentioned, this is part 2 of 2 different webinars. The agenda for today is there in pink. We're going to talk about sleep, food safety, preventing and treating illness, and vaccines. So let's begin. One of the most important healthy habits that we can develop is getting enough sleep. Even though we all have very busy lives, it's important that we get enough sleep in order to stay healthy. If our bodies are well rested, then we're able to fight illness more easily. We can focus better at school or at work or at home. Sleep helps us manage stress, which everyone experiences stress. And it's also important for weight loss. And you might not think of it that way, but when we are tired, we tend to eat more in order to get throughout the day. And while we're eating more, we're also too tired to do any physical activity. As a general rule, adults should get 7 to 8 hours of sleep every night, no less than 6. That's too little. Teenagers, they need 8 to 10 hours of sleep and no less than 7 hours. And children, of course, depending on their age, they need between 9 and 12 hours of sleep. So that's a good guideline for us to follow. Now, when we think about healthy habits, we most often think about our food habits. Canadians rely on storing food. We buy it in bulk and then we put it away either in the pantry or in the freezer. It's not always possible to buy fresh food on a daily basis. So in order to save time and money, many Canadians, they buy the food in bulk and then they just store it. Some food must be stored in the refrigerator or freezer, such as meat and dairy products, as well as leftover food that you might have already cooked. It should always be kept in the fridge. When these foods are left at room temperature, the bacteria in them can grow. And eating food with a high bacteria content can make you sick. And this is what we refer to as food poisoning. Handling food in a safe way also helps to prevent this kind of illness. So frozen foods should be kept frozen until you're ready to cook it. Follow the instructions on the package and read the expiry date. Many foods in Canada have an expiry date. So do not consume dairy foods or baby food if it has passed this expiry date. So the expiry date is the date after which it is no longer safe to eat that particular item. Meat and prepared fresh foods that are past their expiry date should not be eaten at all. And other foods, you might find, they say a best before, and then they have a date right after that. This is not an expiry date, but it's just a recommendation to you that this food will taste best if it is consumed before that best before date. Eating non-perishable foods that have passed this date, they're not necessarily dangerous, they just might not taste as good. Frozen meat should be defrosted over 24 hours in the refrigerator, not at room temperature. Many foods can be stored in the cupboard until they are opened, and then they should be kept in the refrigerator. After handling raw meat, be sure to wash your hands as well as the dishes, the surfaces that you worked on, and the utensils that you used with hot water and soap. Remember that washing your hands with hot water and soap helps to prevent illness and the spread of germs. And During these pandemic times, we are often reminded to wash our hands frequently. You should wash your hands before you eat, after you use the restroom, after riding in public transit, and before you prepare food. Regular hand washing helps you to keep your family safe and to keep yourself safe and prevent illness from spreading to others. So how can we prevent illnesses when they are all around you, and perhaps treat them if you do happen to catch them? Colds and flus are common. And now, of course, we are all also very preoccupied with the COVID virus, especially in winter when everyone is inside, everything is closed up. There are many treatments available on the shelves at the drugstore that can help you with symptoms of these viruses. If you don't get better after a few days of rest, you should visit your doctor. There may be a different cause for your symptoms that requires some kind of treatment that only your doctor can prescribe. If you are sick, you should stay home and rest. This will help you to get better, but it also helps prevent the spread of illness to other people at your workplace or at the school. Many daycare centers will not allow children to attend if they are ill. If you're sick, you should cover your mouth when you cough or sneeze, but you should do this with your arm and not your hand. Cough or sneeze into your elbow to prevent the spread of germs. And now, of course, also we are required to wear masks when we go outside. So that's also a good safety precaution. Vaccines are also a way of preventing illnesses. Vaccines, or you can also refer to them as immunizations, they protect Ontario residents from diseases. Some vaccines that we give to our children are for measles, mumps, and rubella, and for polio. These required vaccines are paid for by OHIP. They are covered by OHIP. And if a vaccine is not paid for by OHIP, it may be covered by a private insurance or maybe by a local public health unit. So, for example, somebody might want to get a particular needle because they are traveling to another country where a particular disease is more prevalent. So if you wanted to get that needle, you can get it here in Ontario, but you would have to pay for that. There are also optional vaccines. Some vaccines may be recommended by the public health unit or by your doctor. Some additional vaccines are also paid by the government for certain groups of people. Depends on the age or gender. Children must show vaccination records when they register for school. So your children will have to show a vaccination record in order to be able to attend school in Ontario. The Ontario government encourages everyone to get a flu shot every year. You don't have to pay for this. This is covered by the government. The flu shot or vaccine helps to prevent influenza, which we call the flu. And if you do get the flu, the vaccine may help reduce the symptoms, so you won't feel as ill as if you had not got the flu shot. You can get this at the doctors, you can get this at many pharmacies. So we encourage you to get the flu shot if you can. Here are some unhealthy habits. Smoking. Everybody knows that smoking tobacco of any kind is a major health concern. Nicotine is one of the most addictive drugs that there are out there, and smoking causes cancer, lung disease, heart disease, and stroke. So it really is not a good habit to have. In Ontario, it's legal to purchase cigarettes and other tobacco products if you are 19 years of age or older. However, there are many restrictions in Ontario about smoking. You can't smoke in the workplace or in the school or on public transit. You can't smoke in a restaurant or in a bar, in the library. And in some cases, you can't even smoke outside if you are too close to those particular buildings. Landlords often advertise because they want tenants who don't smoke. So they advertise for non-smoking tenants, and they restrict where people can smoke if they are on their property. Let's look at alcohol. Here in Ontario, the production and sale of alcohol is controlled by the Ontario government. It is sold in special stores, which we call the LCBO, Liquor Control Board of Ontario. And now we can also buy wine and beer in supermarkets, in some supermarkets. Restaurants, bars, and cafes, they also have to have a license from the government in order to sell alcohol to their customers. So it's legal to buy alcohol in the stores and restaurants and bars as long as you are 19 years of age and older. Drinking too much alcohol, however, can cause long-term health effects such as heart disease, liver disease, high blood pressure, and digestive problems. For women, drinking alcohol while pregnant can harm your baby. Alcohol can be addictive for some people. Therefore, alcohol abuse can lead to family and social problems like losing your job or your friends or causing problems in the family. Drinking alcohol impairs judgment, which can lead to dangerous behavior. And in Ontario, there are very strict laws about drinking alcohol and driving. So in moderation, alcohol is fine, but when you overdo it, that's when the problems can really begin. Drugs is our third. So buying, selling, and possessing illicit drugs, so these are drugs that are not legal in Canada, they can have severe consequences. Drugs are habit forming, you can get addicted to them, and they are harmful to your body and they're harmful to your mind. It's illegal to buy prescription medication if you don't have a prescription. Using medications without a prescription is dangerous for your health and it can become addictive. In Canada, buying and using recreational marijuana is legal. Smoking or consuming too much marijuana can lead to health problems and social problems, just like alcohol. But in moderation, if that's what you choose to do, it is fine. So let's look at our health resources that we have available to us if we need them. These helplines can provide help and support to you or to members of your family. The Mental Health Helpline provides information about mental health services in Ontario. This is a very helpful information and referral service. A specialist will answer your call or your email or your web chat, and this service is available 24 hours a day, 7 days a week, every day of the year. The service is free and confidential. The Mental Health Helpline is at this phone number here, or you can visit the website that we have shown you. The Drug and Alcohol Helpline provides information about drug and alcohol addiction services in Ontario, and the phone number is listed there for you. The Ontario Problem Gambling Helpline provides addiction help, gambling support, family support, and information, and this number is listed there. For more information, visit Connects Ontario at www.connectsontario.ca. Here are some useful resources, mainly for children, teenagers. The Kids Help Phone is a Canadian charitable organization that provides free 24-hour counseling to children and youth across Canada. It provides bilingual services and anonymous phone counseling, web counseling, and referral services for children and for youth. The service is completely anonymous, so you don't have to give your name, and it is confidential. Good to Talk, which is the second one listed there, is a free confidential helpline providing professional counseling, information, and referrals for mental health, addictions, and well-being. And this is more for post-secondary students, for high school students in Ontario. This service is available 24 hours a day, 7 days a week, every day of the year. Wherever you are in Ontario, you can call the AIDS and Sexual Health Info Line, which provides confidential and available services in many different languages. So we've listed here the settlement.org on the top. You see the settlement.org website address. So this is where you can find information about all kinds of different services that will be of use to you as you are settling in. All right, thank you very much for attending this webinar, and we hope that it will be of some help to you.